serve as the Deputy Director for the Injury and Violence Prevention Center here at the University of Colorado Anschutz Medical Campus. Today's presentation is part of our monthly Research2Practice webinar series, where we present topics in injury and violence prevention. Before I introduce today's guest speakers, I do want to go over a few logistics. The first is that this session will be recorded and we will send the video link to everyone who registered. You can also find our past webinars online and we'll put that link in the chat box. Please put any questions you have for our speakers into the Q&A box. We'll be letting each of them speak and then we'll have time for some moderated questions at the end. Please do mark your calendars for our other webinars. In 2021, they'll be each month on the second Tuesday of the month at this time, at noon Mountain Time. And in upcoming sessions, we're going to be talking about adverse childhood experiences. And then in July, in the heat of the summer, we're going to be talking about ski injuries. So now it is my great pleasure to introduce today's speakers. Our session today is going to focus on school policies and practices for violence prevention. We know that unfortunately, youth identifying as lesbian, gay, bisexual, and transgender or gender non-conforming are at higher risk for sexual violence victimization than their straight and cisgender counterparts. But school policies and practices may positively influence school climate and hopefully mitigate this risk. Our first speaker is Dr. Teresa Cruz, who is a research associate professor in the Department of Pediatrics at the University of New Mexico. She serves as the Deputy Director of the University of New Mexico Prevention Research Center. Her expertise includes community-engaged research for the primary prevention of injury and violence. Her current work includes studying prevention strategies at multiple levels of the social ecology and their effect on sexual violence. She is dedicated to reducing inequities among marginalized communities, including Hispanic, Native American, rural, and LGBTQ populations. Dr. Cruz is also serving on the board of the Society for the Advancement of Violence and Injury Research, or SAVR, as immediate past president. Her presentation today will focus on the results of an analysis of school health profiles and New Mexico Youth Risk and Resiliency survey data to determine the association between 4 school practices, policies and practices, and sexual violence. And our second speaker is Dr. Katie Lohmiller, who is the co-founder and director of programming and evaluation at Educational Access Group here in Denver. She supports educators, schools, and districts in sustainably integrating trauma-informed approaches into their practices and systems. We are very proud to claim her as one of our own, as she completed her MPH and her doctorate in public health at the Colorado School of Public Health. Her areas of interest are community and behavioral health and evaluation with a focus on adverse childhood experiences, trauma-informed approaches, youth development and training, and professional development for educators. Today, she'll be speaking on the implementation framework used by Educational Access Group as a mechanism for supporting programming in schools and garnering educator buy-in. She'll also briefly discuss the foundational nature of brain-based, trauma-informed approaches targeting violence, social emotional learning, restorative justice, and other initiatives addressing the causes and manifestations of toxic stress in the educational setting. So we are so thrilled to have you both here. Thank you again, and I will turn it over to Dr. Cruz.
Great, thank you. And thank you all for coming today. I'm going to share my screen so that you can see my presentation, hopefully. And so today I'm going to be talking about some research that we did here in New Mexico, trying to better understand the role of policies and practices in the school setting on sexual violence among students in schools. And so our study was called "And Improves the New Mexico Policies to Reduce the Onset of Violence in Educational Settings." And I want to acknowledge some of my research team members: Courtney Fitzgerald, D. Ross Reed, Melissa Schiff, and Ji Lang Su, and as well as some of our community organizational partners, Equality New Mexico and the New Mexico Genders and Sexualities Alliance Network. We did get some internal UNM funding to do this data analysis, and I want to acknowledge that. I want to start by talking about just making sure we're all on the same page with some terminology that we'll be using throughout the presentation. Most people are familiar with LGB or LGBTQ, which includes transgender and questioning or queer. Here in the study, we're a little bit more specific because we focus on questions in our studies that were regarding, are you lesbian, gay, or bisexual? So it's not larger than that. And then there's a separate question about gender identity. And so, we're looking at those separately here. And then cisgender is anyone who aligns, their gender aligns with the sex that was assigned at birth. And then I'll collectively, in some cases, be talking about sexual minorities as those who identify as lesbian, gay, bisexual, asexual, pansexual, queer, or any sexuality other than heterosexual. And then gender minorities as someone who identifies as transgender, genderqueer, gender nonconforming, gender fluid, two-spirit, non-binary, or another gender from cisgender. So I just wanted to make sure we're all kind of on the same page going in. When we were setting up our study, we were thinking about how violence links to a lot of poor health behaviors and outcomes later in life. And both experiencing and witnessing violence, we know is associated with increased substance misuse, increased risk of suicide, depression, perpetration of violence later in life, as well as, which this is tied to ACEs, I know that Emmy was mentioning earlier, is even chronic disease later in life. And so in our approach, we really look at not just what's happening among individuals, but what's happening with their relationships with their friends and family and other social networks, and then with inside the workplace, or in this case, the school, and then as well, some of the community norms and then policies that influence or affect behaviors of individuals. And so when we were setting up this study, we looked at what did the research show? And there were a couple school level policies and practices that looked like they might prevent different types of violence. And there were different studies showing different types of violence prevention. And some of the studies were equivocal, where they either had a null finding or in a couple cases, negative findings. And so we really wanted to look at what do the data show here in New Mexico. And so we focused on 4 different areas. One is anti-bullying policies, and these are specifically comprehensive policies that prohibited bullying based on both sexual orientation and gender identity. The second was looking at inclusive sexual health curriculum. So this is sex ed within the schools taught with an inclusive eye toward the LGBTQ community. We also looked at what in the literature is referred to as gay-straight alliances, but in New Mexico, they've changed that to genders and sexualities alliances. So we'll abbreviate it as GSA, but just with the understanding that it means both of those things. And then also looking at school staff training, if teachers are taught to work with children of different sexual orientations and gender identities specifically. So we found those in the literature that they had some evidence, and we decided for our study here, we wanted to evaluate the effect of these inclusive policies and practices on sexual violence victimization among all high school students, and then among sexual and gender minority high school students in the state. So looking at our methods, we utilized 2 statewide surveillance data sets, and then we also had some data from our community partners. So we used the 2016 CDC School Health Profiles data. This is a survey that is sent to principals and to health educators, lead health educators at a random sample, stratified random sample of schools in states that participate. And so we gathered those data for 2016. We also for the, which was the 2015-2016 school year. And then also the data from community partners was for that same year, looking at policies that Equality New Mexico collected and data on the GSAs from the Alliance in the state. And then we used the 2017 New Mexico Youth Risk and Resiliency Survey, which is the CDC version of the New Mexico version of the CDC's youth risk behavior surveillance system. And so in our study, we only used data from the students at schools that participated in both of these surveys. The specific questions that we looked at from the School Health Profiles survey were about inclusive sex ed, looking at, is the sexual health education relevant to lesbian, gay, bisexual, transgender, and questioning youth? And then for the staff training, we also looked at, during the past 2 years, had they received professional development on students of different sexual orientations or gender identities. The data from our partners from EQNM, they did an audit of all of the schools and looked at their policies. These were at the school district level that would influence the schools within those districts on anti-bullying. And then the GSA, they collect data on all the schools in the state that have a GSA in them and when those are established, and then if they later are not being used in a school, they track that as well. So the specific questions for the violence outcomes that we looked at were, have you ever been physically forced to have sexual intercourse when you did not want to? And then during the past 12 months, how many times did anyone force you to do sexual things that you did not want to? The second one, they could put in a number of times, but because most of the data were either 0 or 1, we made this into a binary variable for the analysis of yes, no. And then we also in New Mexico, which is not true of all the YRS or YRBS surveys in the country, we collect data both on sexual orientation as well as on gender identity, and specifically asking if you consider yourself transgender, genderqueer, or gender fluid. To this question, we asked, we also had a response, if they do not know what the question is asking. And we did find that there were a substantial proportion of kids that did not understand the question. But within those, the majority, research is showing that the majority of the kids who don't understand the question are cisgender. So within our data analysis, we used descriptive statistics to ensure representativeness, to make sure that the students that were in our study were representative of students in New Mexico. We looked at potential confounding variates, and the things that we found did confound the relationship included grade level, race, ethnicity, and rurality. We built a generalized linear model for each of the 2 outcomes, and then put these different variables in there. And then we did do a subset analysis looking at separately the sexual minority students, the LGB students, and then the gender minority or transgender students. So in just looking at what did the population look like, we were able to show that it was fairly representative of the whole state sample that we get. So with sexual identity, we found that about 16% of our students were LGB or not sure. We did collapse the not sure into the minority group because the outcomes and other characteristics were most similar or more similar to the minority group than to the majority population. The same with gender identity. We found about 5% of our population identified as transgender and or not sure if they were transgender or not. And again, we excluded people who said they didn't understand the question. We found out that about 6% of the population here is housing unstable, which is similar to for our state. And then about 9% were foreign born. And then you can see kind of the pie there showing each of the pieces of looking at rurality among our population. So, oops, sure. So we also know from the literature as well that if you look at the different types of policies that are in schools, there's really a range of who adopts which types of policies or practices. So what we found was about 3/4 of the high schools in our sample had at least one of the policies or practices that we were looking for, but only 5 of them had all 4 of the policies and practices we were looking at. And most common was to just have one of the 4 in their school. So we also looked at which types had in which schools, which types of these policies and practices. And we found the blue bar is the number that said, yes, they did have that policy or practice. And so we found that the highest number was for having inclusive sex education, and followed by having a GSA in the school, followed by having professional development for staff that was relevant to the LGBTQ community. And last was having the anti-bullying, anti-harassment policy that was comprehensive and included gender identity as well as sexual orientation. So then what did we find? This is very similar to what you see in the literature, is that students that are sexual or gender minorities are at increased risk for violence victimization. So when we just looked at these students, regardless of what kind of policies were in the schools, you can see that it's about triple the rate of lifetime forced sex and about 2.5 times the prevalence of having sexual violence occur in the last 12 months. Among the sexual and gender minority students compared with heterosexual cisgender youth. So then when we looked at what's the difference that it makes if you have one of these policies or practices, we looked for all 4. So just to kind of orient you to the figure, the next few slides are going to look like, is across the bottom, you can see each of the 4 policies or practices that we looked at within the school. And then the blue asterisk that shows a little bit to the left in each column is the odds ratio. So this was the odds of having experienced in this case, lifetime forced sex, if you were had the policy versus not. And so having lower odds is what you want to see, that if the policy or practice is in place, it's protective. The line there representing 1 is if there's no difference between the 2 groups. So you can see here that for inclusive sex ed, the blue asterisk is right on that line. And so it didn't really make a difference. This again is for all students in looking at these 4 policies. So you can see here to the left is having a GSA was protective against having forced sex in their lifetime for these students. And it looks like about 20% or 25% lower prevalence of having forced sex in their lives if they had a GSA in the school. The other 3 policies and practices didn't seem to have an effect. You can see all of them cross over the confidence intervals between the red and the green asterisks, cross over that line of 1, which means there was no statistically significant difference for that policy or practice. When we look at having this among LGB students, so now we're looking at forced sex in their lifetime among lesbian, gay, or bisexual high school students. And having a GSA and having inclusive sex education were both associated with a reduction in this. And so you can see the GSA was down around 70% or 0.7, which is about a 30% reduction in the prevalence. And then inclusive sex ed was down pretty close to that. Looking at the anti-bullying, anti-harassment, it's close, but not quite there, right? Is that you can see that the upper confidence interval is right above the 1. And so that wasn't statistically significant, but it was trending that way and looking close. And then teacher training on the left does not appear to have had an effect on the odds of forced sex amongst LGB students. So then when we look here, this is just the transgender students. So we've separated them out. And you can see here that the presence of inclusive sex ed was associated with a reduction in forced sex amongst the transgender students. And again, you can see that in the third column. And then when we look at the presence of sexual violence, this is not, the other ones that we just looked at were all forced sex over the lifetime. This one is specifically looking at the last 12 months and among LGB students. And here you can also see that having inclusive sex ed was preventive among this population. So when we looked overall at what we found, the GSAs do show promise in protecting all of the students as well as sexual minority students from lifetime forced sex, but not the gender minority students. And then we also found that providing sexual health education curricula that's relevant to the LGBTQ youth shows promise for reducing sexual violence among both the sexual minority and the gender minority youth. And we've discussed some of the reasons for this with our GSA network when we were talking about why this might have an effect with the LGB students, why some having a GSA might affect the LGB students and not the gender minority students. And it was really interesting, part of why they changed their name to Genders and Sexualities Alliances was because they felt that the transgender students did not feel comfortable participating in the alliances within the schools. And so that might be reflective of why there was an effect in this population. So just something, we still don't know the answers, but it was interesting to hear from them. You know, we always try to take our data back to community partners and talk to them about, you know, why, and try to help interpret our results. And that was something that they were talking about trying to work on, was making the GSAs more comfortable and inclusive for gender minority students. I do want to recognize that this is secondary data, so there were other things that we would have liked to have been able to look at, like family support for their sexual orientation or gender identity, which I think some other research has shown can make a big difference in the lives of the violence, risk of violence among students. And also something that we're really looking at much more lately is trying to understand discrimination among students. And this is, in this case, just discrimination experiences because of being LGBTQ, but something also in our next YRRS, which is going to happen this fall, we've actually added discrimination questions to try to better understand students' lived experience around discrimination and racism, particularly as well. We also, because these are cross-sectional surveys, it has a limited ability to make causal inferences. We did try to make sure that all of the policies had been put into place at least one academic year before we looked at the violence outcomes, to try to be able to have that temporal information, so that these were taken in different academic years, not at the same exact time. And then when you get to smaller populations, you know, the gender minority students were 5% of the population. And then when we were, you know, putting in other variables among those students, you get to have a low power because you have a small population that you're looking at. So even though we had a large number of students overall, over 12,000, it was much smaller when you got down to, you know, breaking down by race, ethnicity, grade, and gender minority, among gender minority students. So some of the things we're looking at doing next is we want to better understand how these policies and practices are being implemented, and if there are specific things that they are that are what works in how they're being implemented. For example, these were yes/no questions, right? And so the principal could say, yes, we have a sex ed curriculum in the school, but we don't know what that looks like. Is it all students that participate in it? What curricula do they use, and does that matter? And so, so we do have questions about the implementation of these things. The same thing, like with the Genders and Sexualities Alliances, is they have options for the things that they can do at the schools. For example, some of them are more of a social organization where they get together once a month to watch a movie or have pizza or that kind of thing. And it's more of a social place, where others of them do more activist activities where they'll have big events at the school, maybe one in the fall and one in the spring, to raise awareness and bring attention to the issue. So there are obviously differences in how the operationalization of these policies and practices happen. And then we want to do some qualitative research where we're talking to the students about the school climate and to see what it is there that affects their perceptions of what the school climate is like, and their risks. So that's the end of my presentation, and I have my information here, and we'll be happy to take questions at the end after Katie talks.
Thanks, Dr. Cruz. That was wonderful. A lot of questions. It was great work. All right, I'm Katie Lohmiller. I'm going to jump in and share my screen, and I am with the Educational Access Group. Get this going. I am one half of the Educational Access Group. I will shout out my co-director, Haley Gruber, who is on the call but not here on the screen, who is sort of the teaching half of our organization. So where our work comes in, kind of jumping from what Dr. Cruz was just talking about, is we don't work specifically with that population or programming, but why we, I think, fit into this niche today is talking really about programming in schools and sort of that operational, implementation of those policies, programs, teacher training. And that's really where my work lives. So in the Educational Access Group, we support schools in sustainably integrating trauma-informed approaches across the educational setting. So we focus specifically in school buildings, but we work across districts and with schools across Colorado, as well as coaches and educators internationally. So we get to see a lot of different settings, a lot of different environments and cultures within buildings, and that's been really informational. So today, during these minutes, I'm going to talk a little bit about sort of our implementation model, just because that, I think, is what's most relevant to the broader network. And then I'll give a little crash course insight into what we talk about when we say trauma-informed, because there's every chance half of you are picturing yoga and the other half mindfulness and everyone else something else. So, so the SITE framework is what we use, which is the Sustainable Integration Trauma-Informed Education Framework, not a short name. Something learned during a dissertation process that you should definitely go shorter titles. But this came about through a partnership between myself, Haley Gruber, who's my co-director and an educator by trade, and then a school district who was really looking to make a change. And so my goal in my dissertation work, where this initiated, was really to figure out how to sustainably implement programming with educators, kind of having them at the table, because what we found in sort of our pre-work was, there was just a lot of pushback saying, we don't want that one drop-in training. We don't just want you to tell us what we should do and to go away. Educators have such a lift. I don't have to tell anyone that this year, but, I think there was this perception kind of from the outside sometimes that, oh, you're going to get so much pushback if you bring new programming into schools, or it's so hard to get in the door. And I think that was true, but we really took the angle of how do we work with educators to figure out what they want that will feel supportive, but also open that door to new program, to new information. So what we landed on was the site framework. And so this is really a 4-component model that will not be revolutionary to anyone who's working in public health or all the wonderful things you do out there. But the 4 components are: 1, to do professional development with staff. So we heard Dr. Cruz just talk about the potential impact of staff training. And we know for educators, that's a huge input. So school-wide professional development training. The other piece is to do on-site staff support and consultation. That was something that staff said, if you're going to give us new content, new methods, you want us to implement systems, practices, we want somebody there to help us during those early phases, to show us what that might look like, to give us feedback, to coach us along the way. We have an on-site core team at every school we work with, which means there is a core group of staff who is really able to be the boots on the ground, to be the people that live and breathe that content, can at least ask questions, be sort of someone that you're always seeing, again, not having an external entity sort of hold all that information. And then the last piece is to conduct comprehensive evaluation. And this was something that, in sort of dipping our toe into bringing new programming into schools, I think we heard more than we expected, like, oh, you're going to get so much pushback, or educators are going to feel this is too big of a lift. And so we really worked hard to conduct a lot of qualitative and quantitative work with educators to say, what's going to feel useful, what's going to allow us to get data, but what is not going to give you more work. And so when we say comprehensive data or evaluation, we really are saying, how can we comb what already exists in data-rich schools to pull out the information that's going to tell the story? And so I know I haven't talked about content, but this model really was born from just saying, how do we get into schools and make changes where there is a lot of ask on educators, where they want to do right by students, they want to survive and thrive in their school setting as educators, but they get a million things thrown at them from a million different directions. So that's kind of where we landed. And fast forwarding to the present, we work in 10 schools right now, and educator pushback has not been an issue we've had to contend with. And so we kind of have seen over and over again that with a model that is designed to be supportive as well as to bring in new information, we've really found that buy-in to come quickly, and that pushback to not be an issue. And so I think the reason that we bring this to the table today is just to say, when you're working with schools, there are so many hurdles they face, and we as programmers face, or interventionists, or whatever you want to call it. But this model has really shown to be effective in kind of getting through those initial gates, and maintaining a relationship, and creating change systemically and in practices over time. So this is the framework, Giants. Again, built with educators, kind of something that we do all at the same time. It's mutually informing. The big thing there is just that, by having a core team on the ground, by collecting data, by delivering training across time, we work with schools over a 3-year process. We're really able to say, we have a canned content we want to give you. We have information that we feel, is evidence-based, is best practice, but we're able to do it in a way that feels authentic, that feels tailored, and that feels like it's supportive as compared to an additional lift. And so that's really kind of where this framework comes from and why it felt relevant today. Again, why a framework for schools that is multi-component, and why does that feel valuable? We felt like this work was foundational for 2 reasons, and we have up at the top foundational versus other, because if we say it once when we're working with a school, we say it a million times. This isn't something else. This isn't an other. And again, it's just because educators have so much on their plate. So at the point we feel like another curriculum or a new program, you see some of those doors close and people are like, I'd love to, it's too much. So we really try to frame this, and it's true, we're not just making a sale, that this is foundational. So not only is the model foundational, because we found that it's a good way to get any programs and practices sort of integrated into a system if you have those 4 components into place, just because naturally things are layered on in schools, but it's also foundational because of the content. So I'll get to kind of talking about what we mean by trauma-informed in a minute, but when schools work with us and when they integrate trauma-informed content, it's very focused on the brain and on systems change, targeting, what students need, what educators need, with a big kind of push for access to education, for access to programming. And what we've seen is that, we have all these programs listed across the top, whether you're doing restorative justice practices in your school, or you're bringing in a new SEL curriculum. Dr. Cruz mentioned, you can say your school has an SEL curriculum, but that really doesn't kind of explain how that's being presented. Is it in every classroom? Is the teacher enthusiastically delivering it? Or, are her arms crossed, she's standing in the corner and hit play on a video? And those can have really different impacts and what kind of change they make in a system. So we feel like by framing this as sort of a foundational piece as compared to sort of an other lift, and just integrating it into a system, it's really been a way to garner buy-in, to feel like we're offering staff a support and information as compared to asking them to do something additional. And it's felt beneficial to all the asks that they're facing, whether that is, on the academic side or on the, kind of whole child support side of things. So to talk about kind of what trauma informed is, especially, when we were talking about groups that might feel, more marginalized or more sensitized in school, school itself may be the toxic stress. And so when we talk about trauma informed, we like to quickly sort of frame trauma with our educators. And so when you say trauma, you can picture everything from, a 9/11 kind of major event, a global pandemic, or, that lifelong exposure to toxic stress, which could be racism, food insecurity. The big messaging here is that we want stress when we're trying to change behavior, change practices, build protective factors. We always want to add a little stress because stress is what helps us grow and build skills. But what we see and what Dr. Cruz talked about and what's coming up in, the future seminar talking about ACEs is that toxic stress, which really, causes that wear and tear and impacts how students and staff show up in the building. So we quickly try to move sort of away from that word of trauma, just because it can have a lot of connotations that can polarize your audience, and get into that world of toxic stress, which just for whatever reason is a door opener to staff sort of stepping back and saying, how do our systems support those students who may be coming in with, higher levels of stress? And how do our practices either sort of promote or inhibit their access and growth? When we talk about trauma-informed approaches, again, it's a buzzword of the year, if not the decade, I guess. But we really focus our content on the neurosequential model, which comes from Dr. Bruce Perry, who is trauma guru. But the big things with sort of what is trauma-informed in our context is that it's based on the brain. And I think this in itself can be really, it can disarm people because it's not about coming right off the bat and saying, what did you do? What do you think? What do you feel? But you really kind of rewind it and say, what does the brain need? How does the brain operate? So brain development and function, which is critical to educators, and behavior change, it's strengths-based. Trauma can often feel pretty heavy, but we really focus it on, that strengths development. You're focusing on building skills with appropriate scaffolding. And then the biggest thing is that it's biologically informed and developmentally sensitive, meaning that it's best for the body and brain, and it meets students and staff where they are, which is really critical to any behavior change, as we know. The work lives in the organization of the brain. And I won't get into this because it's a lot, but I just flashed this to say that, something as complex as the brain, when we deliver the content, is really distilled down to Dr. Perry's little triangle brain you see in the middle there. And we focus just on so much of what SEL curricula focuses on, which is, where are we when we're in fear and terror? We're down in our brainstem, which is really sort of the dumbest part of our brain, but keeps us alive. And where do educators want students to be? They want them to be up in their cortex, where they're doing their highest level thinking. And just thinking to what Dr. Cruz was talking about, if you're in a school where you don't feel safe, you don't feel welcome. If you're coming from an outside environment where you feel threat, you feel alarm, you're going to be down in these lower parts of the brain. And despite, sort of practices in place or systems that may inadvertently not be supporting you, you're not going to be able to access that higher part of the brain and that higher learning, which is obviously going to come at odds with your education, your access to education, and how adults respond to you or your peers. And we just, again, focus on sort of, even if you're supporting high schoolers, these areas of the brain can be impacted so early. You see down at the bottom, 0 to 9 months. But when we're in fear and terror, when we experience trauma, we see those impacts carry on into adulthood, into that chronic disease, into those ways we show up in school buildings that may be less socially acceptable. And so that's really what the work targets, is saying, how are we receiving students? And that's a big ask of educators. And so that kind of gets back to that framework, saying by implementing the SITE framework, we're able to ask educators who may not have any of this brain-based content in their back pocket to make some significant changes, to shift mindset, to shift practices. But by doing it in a way that feels comprehensive and supportive, we've seen great outcomes and great results. And so I throw this up, it's all about the adults, because when we're doing interventions in schools, I think pretty universally, it's to target students, it's to target youth. We want the best outcomes for our kids. But what we've seen with this model and what we've seen with our work is that when adults are the target, because they hold so much power in the buildings, that really is where we could see those shifts that then let students have more of a voice, have more access, have more equity in their education. And so we really have found that by targeting the adults with that 4-part model, allowing them to feel supported, to feel like their needs are being met, students are better served. We're able to get more programming in, whether that's violence prevention, whether that's social emotional curricula, or even academic supports for students who are dysregulated due to their toxic stress. But really that comprehensive target of the adults in the building has led to substantial change on both the adults and everything from staff turnover to educator efficacy, down to students who are missing less school, who are showing increased test scores, and who can have a voice at a table they never felt they had before. So I will wrap there and hand it back over, but thank you so much for joining us.
Thank you both for those wonderful presentations. And it's perfect. We have a little time for some questions. So we have a few questions in the Q&A for the audience members. Please feel free to keep them coming. So I think I'll probably just go in order that they came in. So the first, Dr. Cruz, was for you. Some questions around more specifically what was included in the teacher training, which I think gets a little bit to what Dr. Lohmiller has been talking about as well, in terms of how we actually integrate policies and programs. And then interesting second part of the question around whether you considered intersecting identities of LGBT and then youth of color as well as adults, sort of recognizing that the additional racial or ethnic disparities may sort of overlay and further increase risk.
Yes, thank you. So with regard to the teacher training, so that's what is it? Is we don't know. The question that was in the survey is a yes, no. And so at this point, we don't know what the trainings, when people said yes, what those included. And that's something that we want to go and find out. So that's stay tuned for future work. For the intersectionality, we did not ask the specific question, what role does intersectionality play? We found that the numbers got too small, especially if you were looking at transgender Native American kids kind of thing, that the numbers were really tiny. But we did find that there were differences by race, ethnicity, and that's why we included race ethnicity in our models, is because it was associated both with the outcomes and with the policies. and their effect. And so I think the answer is yes, they probably do, but we did not specifically ask that question and look at intersectionality in our work. And for most of the populations, the numbers, when you were looking especially at gender minorities, were really small.
Thank you. Another question for you, Dr. Cruz, from Carol Runyon. Were you able to look at the combinations of policies or practices and whether certain combinations might be most helpful?
So we did do that. We didn't find that it was certain combinations, but we did find that the more you had, so if you had 2, 1 was better than 0, 2 was better than 1, 3 was better than 2, but there was no extra boost with having a 4th one. But we didn't find that a significant difference in which 3, for example, or which 2 or which 1 when we looked at that.
Okay, thanks. And this one, I think maybe for either or both of you, but maybe Dr. Lohmiller first. Do you have, can you kind of summarize where you feel like things are at in Colorado in terms of what we should be doing or could be doing better? I recognize too, there are lots of different school districts, and so that might be sort of a complicated question, but maybe I'll pause there for the first question.
Sure. I mean, yeah, there's such a breadth of schools, but I think especially in the current climate coming back into a school year, which we're ending one, but planning for next year, I think regulation for adults and students is going to be so critical as we re-enter school buildings and classrooms. So just planning for, how are we building in those whole supports for students and staff who are having to come back in from such a different time at a lot of different places. So I think just educator support and training is going to be more critical than ever to understand where students are coming into buildings.
Mm-hmm. And Dr. Cruz, how did you consider and address the prevalence of dating relationship and dating violence in your study in New Mexico?
So sexual violence was one of the things that we looked at. We also looked at dating violence and at bullying. And so we didn't put dating violence into the sexual violence equation, but we looked at it as a standalone. And if I'm remembering correctly, the GSAs were preventive of dating violence among LGB group. And I think that was the only significant finding that we had. It was not, GSAs were not significant in the transgender group. And that was part of what we were talking with the GSA network about, trying to understand, is there a way that they could be more inclusive of transgender students?
Thanks. No, I have a couple questions too, and I think a few more coming in. As I was listening to you, I was thinking about sort of my multiple overlapping roles that many of us have, right? So I'm an injury prevention researcher. I do some parts of advocacy. I'm a parent with kids in public school. As you think about sort of what we need, particularly in that advocacy realm, where does this action need to happen? Is it at the level of, I mean, I recognize the sort of need to engage schools in the training and the integration, but does it, and the actual rollout, but does it need to be sort of higher level policies? And are those then at the school district level? Is it the state level? Like, where should people be advocating? I guess is the question. Where do we get involved?
Did you want to start? No.
Go ahead.
Well, so that's one of the things when we were looking at our results that we're interested in. The only one of the 4 things we looked at that was at the school district level was the anti-bullying, anti-harassment policy. And when we looked at just that with bullying, there was a reduction when it was the only policy in the model and it was just looking at bullying. But it wasn't associated with reductions in the other sexual violence or dating violence. So I think the district can set a tone, but I think it still gets back to how are things operationalized within the school. And so I do still think that it's really valuable for parents. I don't know if in Colorado, do you have the SHACs, school health, I forget what the AC is, committees forgot what the A was, but a school health committee. Our schools here have that where parents can get involved and request different things or look at different things or ask about different things for the health of the students there. And so I'm thinking at the school level, how things is really what influences how things are operationalized. And so while I do think that there is value in having things at that higher, at the district level or at the state public education department level, that came into play a couple years ago. The state mandated that we do training around something, and I can't remember exactly what it was, but then all of the schools were like, how do we do this, right? And so I think that's to me is the key, is getting the how do you do it into play at the school levels.
I would agree. I think district policy is always great, but again, I think to that, there's been districts who have said we don't suspend kindergartners, because that seems like a good move, which is true. But does that change what practices are punitively happening in a building? Maybe, maybe not. So I think what I would advocate for is, always more adults in school buildings. I just think that alone would be a tremendous move. But training for educators and communities. I think every school we work with always says, great, how do we push this to our community? Because again, that school day starts and stops. That school is a hub for the community, but there's that time outside. So I think that advocacy for training for educators, training for communities, so that that web can expand. Teresa sort of highlighted, we know that social ecological model plays in so huge. So that would be tremendous.
Thanks. I was thinking, as you said, more adults in buildings, I was thinking how I haven't been able to go into my kids' schools all year, right? And that brings me actually to my next question, which is, so Dr. Lohmiller, you mentioned sort of hopefully in the fall, right, when schools are really back in person and what's going to happen. Do we have any sense of what this past year has meant, especially for kids in remote school or hybrid school, what it has meant for some of these around bullying, harassment, sort of violence precursors for youth in the LGBTQ or transgender communities? Do we know anything in terms of like, has it been better to be remote, worse to be remote? Sort of, I realize it's complicated.
Yeah, I cannot speak to the data right now. I think that's sort of changing, but I will say, anecdotally, we are seeing some students who are thriving online because, again, that social pressure, that environmental stimuli has decreased. We also do classroom observations and see students who are feeding 3 siblings, managing a class and having life happen. So I think that's really hard, but I think we are seeing a real impact in those social skills, those social connectivity moments that kids typically thrive in. And I think, there are some of those reductions, but I think the bigger impact has been that isolation, at least, anecdotally in what we're seeing with students. And we know there's more abuse and neglect happening just as a result of, lack of adults.
Okay. Going back to the chat box, so in the vein also of the sort of research to practice, there's a question for you, Dr. Cruz. Have you shared your findings with school administration? And if so, how did they respond?
So we have not shared them with the administrations yet. We have been talking with our partners, our community partners, and so we're trying to figure all of that out now. But that is part of the plan that we will be able to share. And thinking about the last question, I was thinking in New Mexico, and again, we don't have it now, it'll be about now next year. We did decide to add to our YRS survey for this fall questions on mental health during COVID and on effects on parental jobs and effects on school work during this time. So we will be able to, again, in another year, to be able to look back and see what the students are saying about that as well.
That's great. The next question is around funding sources, including sort of pointing out potential funding from the Administration for Children and Families. I'm just curious if you could talk kind of generally where you get this work funded, both the research, but also importantly, the sort of implementation and policy program evaluation.
So I can start. The research for this project was funded internally. We have what's called RAC grants, research something, but they're internal. So I'm in the Department of Pediatrics, and so in the Department of Pediatrics have their own internal funding that you compete for within the university, and so that's what funded this. Outside of this, we're looking now to NIH and to Department of Education to see if there's funding, and to actual Kellogg Foundation, and I was thinking there was one other, WT Grant Foundation, who specifically actually has some work out for LGBTQ youth and disparities. And so we're looking at a variety of different sources for kind of the next steps of implement more of the implementation research and the qualitative study.
And I can piggyback, it's a wide range, but we do have schools. Every school we work with does their best to put what they can towards the work, which is, again, so commendable at this time. And then we've been fortunate to have some grants locally, and then we have some private funders who have also contributed to the work. And I think based on their own educational experience in many cases of saying, this was not the experience I would have wished on anyone, and I want to see that change happen. So we've been really fortunate, but co-applying with schools is a wonderful venue for this kind of work as well.
Thanks. That's always helpful for the audience to hear some of the practical tips about how you actually do this work. And in that vein, my last question for you both is, we often have a lot of students who are interested in getting involved in various kinds of projects. Do you ever have opportunities for students?
All the time. We've had students, high school to medical students to postdocs, just kind of the whole range of learners. And then for the efforts going on in communities, we've talked with the GSA network about, for our next steps, that we would want that to have some student leadership and involvement in it. So yes, so we definitely try to engage with students at all different levels, helping with the research piece, but also then with the community or designing implementation piece.
Wonderful.
And we are much smaller, however, definitely open to students. We've had some independent study programs or projects with MPH and DRPH students. And then, yeah, we actually have some high schoolers who have served on some of our board efforts. And so we're always open to extra eyes and ears and hands.
Oh, wonderful. Well, thank you for, that's great to hear. And I just want to thank you both again for a really wonderful talk. There's a thank you in the chat also calling out what an interesting and useful session this was. Thank you to all of our attendees. Our next session is going to be on June 8th on adverse childhood experiences. I encourage you to join us then as well. Thank you again to our speakers and to everyone for coming. Be well.
Great. Thank you for your interest.